been a few weeks since Meera gave birth. The baby is healthy. Her family says she is so lucky, but she finds herself crying when no one is looking. She thought she would be happy, but mostly she feels tired and guilty for not loving the feeling of being a mother. Ria. Ria used to be an energetic, optimistic girl who was always in control, the one who held everything together. But now, even the simplest tasks feel impossible. She feeds the baby, she folds the clothes, but inside she feels nothing. She feels detached. Her face is blank. Her husband asks her if she's okay. She just nods, but her eyes are distant, and she whispers to herself, I don't think I can do this. Priya. Priya hasn't slept in days. She fears she might harm herself or the baby. Her thoughts scare her. She feels like a danger to her own baby. She's afraid to be alone with her baby, but she is so afraid to tell this to anyone. It's normal to have feelings of worry or doubt, especially if this is your first time. But if your feelings include feelings of extreme sadness, loneliness, severe mood swings, and frequent crying spells, you might be having postpartum depression. So, what is postpartum depression? So, after childbirth, nearly 50 to 75% of women experience what we call as baby blues. Now, these are simple emotional ups and downs, slight mood swings, crying spells. This typically fades within 1 or 2 weeks. But when the sadness sticks around, when you stop enjoying the things you used to love, when you feel detached from your baby, your partner, and even yourself, and think of harming yourself or your baby, that might be postpartum depression or PPD. But remember, it is not in your head. It is not a weakness. It is a real medical condition affecting 1 in 7 women, and it deserves real care. So now let's understand, why does postpartum depression happen? So the first is massive hormonal crash. Now, during pregnancy, estrogen and progesterone levels are almost 10 times higher than normal. And right after birth, estrogen and progesterone levels drop sharply. Now, that affects serotonin and dopamine levels. These are neurotransmitters, your mood regulators, which are released from your brain. Sleep deprivation. So, we all know newborns don't follow schedules, and chronic sleep loss actually rewires how your brain handles emotion. Psychological stress. Now, the pressure to be the perfect mom, body image issues, feeding issues, and the guilt, it all adds up. And also, women who've been struggling with anxiety and depression earlier, your risk of postpartum depression is higher. Do not forget nutritional deficiencies, low levels of omega-3 fatty acids, iron, vitamin B, vitamin D. They all can deeply impact your brain and mood. So now let's talk about the spectrum of PPD, which means that every sadness is not really postpartum depression. So postpartum mood disorders, as we call them, are broadly categorized into 3 categories. The first is postpartum blues, then postpartum depression, and a very serious condition called postpartum psychosis. So what is postpartum blues? Also known as baby blues or maternity blues, this is common mild form of emotional changes experienced by many new moms. It typically presents within first few days after birth and may last for a couple of weeks. It could be simple mood swings, crying spells, little bit of anxiety, difficulty sleeping. Then, what is postpartum depression? Now, this is more serious form of mood disorder which can develop at any time during the first year after childbirth and may involve feeling of sadness, hopelessness, worthlessness, and loss of interest in daily activities. It could also cause changes in your appetite, difficulty in sleeping, difficulty concentrating, guilt, shame, loss of interest in the baby, partner, and thoughts of self harm and harming to the baby. Now, this definitely requires treatment, usually with some medications and psychotherapy. The third is postpartum psychosis. Now, this is rare, but a very serious psychiatric emergency. And in this, there could be sudden onset of psychosis, typically within first few weeks post-delivery. It can cause hallucinations, delusions, disorganized thoughts, posing a significant risk to the life of mother and her baby. Now, postpartum psychosis requires immediate medical care. This is a psychiatric emergency. So now let's talk about what is the treatment for postpartum depression. So remember, first thing, postpartum depression is not a flaw or your weakness. It is a proper medical condition. And like any other illness, it deserves care, not shame or guilt. The first step is to talk and to seek help. Tell a friend, tell your partner, mother, or anyone close to you. So there are various treatments available. The first is taking a therapy. Now, therapy is one of the most effective tools for healing from postpartum depression. So there could be cognitive behavioral therapy, also known as CBT. This helps you identify negative thought patterns and it teaches you coping strategies for those mood swings and anxiety. You could take weekly offline or online sessions with your therapist. Then there's something called interpersonal therapy, IPT. This focuses on improving communication and support in relationships. This especially is helpful for new moms who are struggling with partner or family dynamics. Then, of course, we have support groups. You could, log in online, or there could be in support groups which are available these days. So remember, talking to others going through the same reduces guilt and isolation. So you can search online for Mom's Belief Circle. This is an Indian support group. Then we have a Postpartum Support International group. This is a global support group. You can also even start with apps like Mind Peers, BetterHelp, or Manastha. These are India-based apps. Then, of course, if the therapy doesn't work, you definitely now need a medication. There are certain common antidepressants which can be used for postpartum depression. These are generally safe while breastfeeding, and your doctor can definitely guide you about the dosage and various options. But remember, it takes about 2 to 4 weeks to show the effects. And once again, remember, there is no shame in needing medicines to get back to yourself. And most important, never self-medicate or on the advice of non-doctors, which could be your family, friends, or anybody who's not a doctor. Then there are some nutritional supplements which can help you in postpartum depression. So omega-3 fatty acids, they help with your brain and mood support. Vitamin D3, it helps with hormonal imbalance, immune support. Magnesium glycinate, it is calming, it improves your sleep and helps you with your stress relief. Iron, B12, folate, they all improve your energy, mood and brain health. Then, of course, ashwagandha. This is optional, but this is known to improve the cortisol regulation. But remember, always get your levels tested before starting any kind of supplements, especially vitamin D, vitamin B12, and iron. And please talk to your doctor before starting a supplement. Then, coming to powerful lifestyle and practical care tips for postpartum depression. So, number one, and most important, sleep well. Sleep in shifts if possible. Ask your partner or parent to help. Eat warm and nourishing meals. Do not ever skip meals. Add good fats and protein. Walk, stretch, do a little bit of yoga. Remember, movement always boosts the endorphin levels. Journal your thoughts. While even it could be writing one line per day, even if it is saying, "Yes, I survived today." Expose yourself to some good sunshine every day for at least 20 minutes. And once again, say yes to help. You are not weak for needing support. You are a human. Motherhood is beautiful, but it's also complex and messy sometimes and exhausting most of the times. Having big emotions doesn't make you a bad mom, it makes you an honest mom. But please don't carry this alone. And if this video helped you feel understood, even for a moment, share it with someone else who might need it too. And if you feel ready, comment below with something you wish someone had told you when you became a mom. And once again, like always, do not forget to like, share, and subscribe to Maitri. And I will see you soon.